We expect a lot from our doctors. They're constantly under pressure to perform, and when caring for patients, there is no room for error. But doctors are people too. They get stressed and burned out. They can suffer from mental or emotional illness. They can fall victim to addictions or self-destructive behavior. And when they do, it can affect their careers, their families, and even the safety of their patients. When this happens, where does a doctor turn for help? Since 1978, the answer in our state has been the Tennessee Physicians Health Program, operated through the Tennessee Medical Foundation, an independent, nonprofit organization. Dr. Roland Gray has been medical director since 2002.
Our primary mission is still to assist physicians who have an alcohol or a substance use disorder, but over the years, our role has evolved, and at the request of medical societies, hospitals, families, and physician groups, we've expanded our scope. And today, alcohol and substance use disorders are about half of what we bring into our program to assist.
The PHP's mission is to protect patients through identification, intervention, rehabilitation, and the provision of advocacy or support for physicians impaired by addictive disease, mental or emotional illness, and behavioral issues. Supporters say this program is critical for Tennessee doctors at a time when medicine has become such a challenge.
Personally, I think we're probably maybe our own worst enemies, and we're also very reluctant to seek help. We're supposed to be helping others. And we have some unique, I think, emotional and mental challenges that come along in being a physician. So I think having an organization supported by physicians, run by physicians, helped by physicians, makes it more comforting.
Dr. Doring is a longtime supporter of the foundation because, as a hospital and residency program leader, she saw its success.
I know of many physicians who have been through the TMF and are actively practicing and have been very much supported. I also know of a particular resident that went through the program that was struggling in our program, who has ended up now as a successful physician practicing in the state. So it's so rewarding to know that people have put so much time and energy into their education and residency and can be, rehabilitated to return to the practice.
Another champion and longtime supporter is former TMF board president Dr. Mac Worthington, who also credits the program with restoring physicians in his hospital and his residency program to health and practice.
That was very satisfying to see how well they did and how successful they became, and how it brought together not only their license, but their life back, their family back. It was an amazing thing to see, and I was very happy to be a part of that.
In an ever-changing environment, Tennessee maintains an approach that gives a second chance to doctors who succumb to addiction, emotional and mental stress, or illness. It is effective because it emphasizes personal accountability through a partnership with those who are in the program.
It's a collaboration with those that we work with. It's not a disciplinary model, and it involves long-term sustained monitoring with adverse consequences if they do relapse. Our expectation is that they won't relapse, and very few of them do.
Tennessee's PHP has become a model for other physician health programs around the world. It has also become a consulting and educational resource on issues like addiction, chronic pain treatment, overprescribing, and overall physician health and well-being at the state and national levels. The growing demands on the foundation mean it requires more consistent financial support from those who benefit the most from its services, Tennessee physicians.
I would say the TMF supports physicians, so physicians should support it. I would say that if I was having an issue and was referred there either by colleagues or myself, that I would be glad for the help and would hope that physicians would support that organization.
I've said this on a number of occasions, that I cannot think of any organization
in Tennessee or even in the whole country that I'm aware of that does more for physicians than the Tennessee Medical Foundation. That's why it's important to me.
I think it's important that physicians support their physicians' health program. We need physicians who are doing well, who've benefited from our program, and there's probably not a medical group or hospital in the state that has not benefited in some way from our program, to support the Tennessee Medical Foundation for our ongoing support. Sometimes say if there's no money, there's no mission. So the continued financial support is critical.
The Tennessee Medical Foundation relies on contributions to carry out its mission to step in when doctors are hurting and restore them to good health and practice. Please help us ensure it will be here when it's needed most.
To me, it's one of the top places I contribute to and feel really good about.
There's still going to be doctors affected by alcohol and drugs. It's going to be an ongoing problem. And I can't think of any better way to support your fellow physician than participating in this program.